And I think that's where acknowledging that there's going to be triggers and activating comments made everywhere and creating safe spaces like you have where people are, because I anticipate many people, I've heard it, and you might have heard it for the people that do eventually come in, or people are avoiding going out, but specifically avoiding medical care because of how it feels to be shamed for their weight.
Absolutely. I hear that all the time. And a lot of the times when I do see patients, like they're not up to date on basic screenings, pap smears, mammograms, if it's, applicable, those sorts of things. And it is because like if you don't go in, you're not having the opportunity to have that discussion about those screenings that could be beneficial for you.
Mhm.
And then there can be metabolic conditions that have not been diagnosed
Mhm.
and would have been easier to manage potentially at an earlier stage, but now require medication. And then there's this sort of like self-blame on
Mhm.
the patient side of like, oh, I did this to myself. And I'm like, right, but this could have maybe been addressed earlier. And it's not like you weren't coming in because of what you've experienced. That's not
Mhm.
something that you should blame yourself for. But then when they go in, they are blamed for it. They're like, oh, well, you haven't been taking care of yourself all these years. Like, I haven't been coming in because I didn't want to
Mhm.
have this lecture, you know?
Mhm.
And so that is a lot of times things that I see is just like not being up to date on things, having diagnoses that could have been caught earlier with proper screening. And, there's a lot of discussion about this, I think, in the health at every size community. I don't think it's been adequately studied is like how much of the outsized risk that we see for cancers and metabolic conditions are related to a true relationship with the weight and this diagnosis, or actually a lack of medical care
Yeah.
and that diagnosis being made later.
Mm. Mm.
Um,
Mhm.
and, I think that's something that it's just sort of assumed that there's like, oh, correlation, causation, right? But it's like, well, maybe there's the correlation and there's another cause there that you're not
Yeah.
thinking about.
Mm.
And that's, like you said, that's not the thing that sells. So that's not what we are always studying. But I think it's an important question to be asking yourself. And I think it's just why it's important to not focus on so much on that number and to focus on the big picture. And focus on the behaviors that we know are associated with improved health rather than more disordered, unhealthy behaviors that might lower the weight number but make everything else worse.